A new study of coronavirus antibody tests that are currently on the market revealed that at least 8 out of 14 had an accuracy rate of more than 95% and 3 of those were more than 99% accurate, but doctors remain concerned that more work needs to be done before they can be solely relied upon to restart the world's economy. There are dozens of tests being sold to the U.S. from manufacturers, including some in China, which tests the blood for antibodies that scientists hope reveal an immunity to COVID-19. But none have received FDA approval, and there are growing questions over how reliable they really are. Many return false positive results, and it remains unconfirmed that even when antibodies are accurately detected, that they offer long-term immunity to the virus. 2 separate studies of 14 antibody tests carried out by a team of 50 researchers working for the COVID testing project in San Francisco, who were partly funded by Mark Zuckerberg's charity, the Chan Zuckerberg Biohub, and others at Massachusetts General Hospital, found that only 3 Shore Biotech, 1 Faux Biotech and 1 in-house made by the researchers had an accuracy rate of more than 99%. They sampled blood from 80 people known to be infected with the coronavirus, along with 108 samples donated before the pandemic and 52 samples from people had other viral infections but tested negative for COVID-19. A data table reveals they ranged from 84% to 100% in identifying the 2 types of antibodies that researchers want to see in order to detect coronavirus immunity. The tests also varied when they detected antibodies among all of the samples. In some, they did not appear for more than 20 days. The research has not been peer-reviewed yet. Some of the researchers say that so long as the data is being read properly by well-trained scientists, it can work as a tool to beat the pandemic. They herald it as a promising new piece of information. There are multiple tests that look reasonable and promising. That's some reason for optimism, said Dr. Alexander Marson, one of the leading scientists on the project, said. Those numbers are just unacceptable. The tone of the paper is, look how good the tests are. But I look at these data, and I don't really see that, Scott Hensley, a microbiologist at the University of Pennsylvania, said. He added, if your kit has a 3% false positive, how do you interpret that? It's basically impossible. If your kit has 14% false positive, it's useless. There remains an enormous problem that it has not yet been proven that having the antibodies gives a person immunity to the virus. It seems like all of a sudden, everybody just decided that antibody tests are going to give them some grand answer, Dr. Michael Osterholm, an infectious diseases expert at the University of Minnesota, said. We're kind of heavily leaning on these tests when they're not perfect. And we still have a lot of people susceptible, so it's a dangerous thing to heavily rely on them right now, Saskia Popescu, an epidemiologist at George Mason University, added to the Times. Last week, a study of 3,000 people across the state of New York found that more than 21% of people tested in New York City had the antibodies. The percentages were far lower in more rural parts of the state, and the findings have bolstered Governor Cuomo's plan to reopen parts of upstate before New York City. Other states, where there are fewer COVID-19 cases, are reopening without an antibody testing plan. The federal government has repeatedly said that the country is a long way off from finding a reliable enough antibody test to reopen the economy. They are yet to produce one or distribute one on a mass scale, and instead have decided to allow companies to sell their tests to the public without FDA approval. It created the Wild West scenario that is now unfolding. The World Health Organization gave the grave warning on Friday that recovering from coronavirus does not necessarily give a person immunity to it. Some governments have suggested that the detection of antibodies to the SARS-CoV-2, the virus that causes COVID-19, could serve as the basis for an immunity passport or risk-free certificate that would enable individuals to travel or to return to work assuming that they are protected against reinfection. there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection, the organization wrote in a briefing on Friday. Chile has announced it will give citizens so-called immunity passports to try to get them back to work. No study has evaluated whether the presence of antibodies to SARS-CoV-2 confers immunity to subsequent infection by this virus in humans, it said. Thank you for watching our video. Please show your support by subscribing to our channel and turn on the notification. Follow us on Twitter, Instagram, Facebook and Reddit for more videos.